What is this investigation that we are seeing here? So this is an oblique X-ray. So first step, every time they give you contrast study as the question, the first step that I want you to look at is the background showing me a radiograph? Is the background showing me an X-ray? If yes, yeah, you're on the right track. Look for contrast. It's indeed a contrast study. It's indeed a fluoroscopic study. Okay. So is this RGU? Is this MCU? That is the whole question here, right? That is something that we need to know. So here you can see the femur. You can see the obturator foramen with the pubic rami, isn't it? So this is an oblique kind of image. We have asked the patient to be in an oblique manner such that I can see the entire extent of the urethra. Alright, so what are we doing? This is the shaft of the penis, and we are seeing that there is a catheter here at the external urethral meatus, and we are putting contrast here, and we are seeing that the urethra gets opacified. What is this part of the urethra? This is the penile urethra. Then it takes a turn, it takes a bend, and it becomes bulbous, isn't it? So this part is the bulbar urethra. Both of them together constitute the anterior urethra. Slowly it tapers into the narrowest part of the urethra, which is membranous urethra, and then prostatic urethra, and some of it goes into bladder. So now, what is the direction? Tell me. The direction of contrast is like this. How is the direction of urine that we pass physiologically? It is from the bladder to here. So can I say we are going in a retrograde manner? Yeah. So hence the name retrograde urethrophy. Why urethrophy? Because we are seeing the urethra, we are imaging the urethra. Hence the term RGU. So the first most essential step for all of us is to identify that this is RGU. How to do that? The most distended part is what? The most distended part here is anterior urethra. So when you see that anterior urethra सबसे dilated है, सबसे distended है, we are looking at RGU. Vis-a-vis, which is the other investigation we want to compare this with, that is MCU. Alright, MCU माने micturating cystourethrophy. So now tell me very logically, micturating cystourethrophy. If somebody is micturating while you are imaging, yeah, will it be in the physiological direction? Yes, it has to be. So how do we put contrast in the bladder in the first place? So this here, the step that is involved is you first put in a Foley's catheter. Alright, so the first step is to insert a Foley's catheter in the patient, and then you will inject diluted contrast. So you inject around 400 to 500 ml of diluted iodinated contrast into the bladder. Now just imagine if somebody is to inject 400-500 ml of saline or contrast in your bladder, will you start feeling the sensation to void? Yes, that is exactly what we want. The patient will say that, okay, now I have the sensation to void. So we will tell the patient, okay, void. Alright, so that voiding we will take as a video of the X-ray. Alright, so while the patient is voiding, the X-ray is started. The video is started such that we see that the urinary bladder is completely distended. The patient is voiding, so the urethra is distended. And now, because the direction is physiological, what part is the most distended? It's this part here, isn't it? It's the posterior urethra, because that is getting the urine first, and this is the anterior urethra. So how do we identify MCU? The bladder will be distended. The posterior urethra will be maximally distended. Alright, so first step is clear to everybody, which is the foundation, recognizing that it's RGO or it's MCU. If that is a go, then I will tell you pathologies. Then I'll tell you what is the role of these investigations. Okay, so let's go back to retrograde urethrophy. The ultimate thing which has been tested so many times is RGU's role as far as urethral trauma is concerned. Alright, so urethral trauma, what is the investigation of choice? It is RGU. What if I tell you what is the investigation of choice for posterior urethral trauma? This is something that I want all of you to tell me. कि मुझे posterior urethra देखना है. Most dilated posterior urethra is seen in MCU. So is the answer for posterior urethral trauma MCU? If yes, then think again. Go back to the steps. What is the step of MCU? The first step of MCU is putting in a Foley's catheter. In any patient, whether anterior or posterior urethral injury, can I put in a Foley's catheter? Can I put in a Foley's catheter and do MCU? Can a patient with urethral injury void to give me micturating cystourethrogram? He can't. Two things. I can't put Foley's, patient can't void. So is this investigation possible in any case of urethral trauma? It isn't, right? And this is where they'll trap you. You will be like, अरे मुझे तो बहुत आता है. I've seen MCU so many times. I know कि posterior urethra सबसे distended होता है, वही होगा. And see, so fresh from knowledge you guys are. एक मिनट पहले पढ़ा and then everybody was like कि हाँ मैम posterior urethra मतलब MCU. But again, logic, right? Patient cannot void when he has urethral trauma. So that is why the answer for any urethral trauma, RGU, anterior, posterior, lateral, medial, any urethra, remember we won't do anything, we'll do retrograde urethroplasty. Okay, is that clear? So this is the investigation of choice